education, that our world is filled with acronyms that many people don't understand and find them to be very confusing, but they're integral to the success of students. And therefore, we're making an effort to demystify some of this and speak about the instructional process, interventions, and services that are offered to students both in a general education and a special education setting. So at this time, I'm going to introduce just some of the acronyms that you'll often hear and explain a little bit about what that even means. So sometimes you'll hear us refer to MTSS, which is multi-tiered systems of support. Multi-tiered means exactly what you might think. It is a 3-tiered approach to supporting students in a general education environment. And if you notice, systems is plural, because when we're speaking about MTSS, we're speaking about academic and behavioral, social, emotional supports that can be put in place for students. So while there are multiple layers through which this can be done, there's also multiple different aspects of a child's education that fall all under this one umbrella. Additionally, you might hear that your child has been referred for academic intervention services, or AIS. That again is happening in a general education setting. However, it may be happening outside of the regular classroom, and we'll talk a little bit about what that might look like. Sometimes students need some additional supports that cannot be met in the general education setting, and they might be referred to the CSE, which is the Committee on Special Education, and similarly the CPSE, which is a Committee on Preschool Special Education. So once a child is school aged, they will be supported through the Committee on Special Education, but prior to that, they might receive early intervention services, and then once they become 3 years old, they may also receive preschool services. Our aim in all of this is to educate students to be successful in their least restrictive environment, and I'll talk more later in the presentation about what exactly that means. But we always want students to be able to be successful as much of the time with their general education peers as possible, even if that means that they need special supports to be able to do that. And all of that is really what constitutes a child's free and appropriate public education, which is a right that students have. So as we unpack a little bit about what MTSS means, first we're going to talk about how we identify that, right? So when a student is not meeting grade level standards, and typically we have standardized assessments or benchmarks that would give us a clue that a student might be struggling, we would initiate 3 tiers of interventions in order to assist him or her to achieve academically or behaviorally. And as of late, we've really started focusing on the social emotional aspects of a child's development and education as well. In addition, throughout this process, we're going to have a very keen focus on progress monitoring data that is collected. And that's because we want to see how the student is responding to the research-based intervention that we put in place in order to support them. So this was essentially designed to approach grade level expectations and transition students out of services and towards independence. So none of this is a life sentence, essentially. We're really hoping that with some intensive intervention, students can return to independence in the general education setting as soon as possible and be able to meet those grade level standards all on their own. There are typically 3 tiers that are identified in the MTSS process. So tier 1, or the primary level of instruction or preventative instruction, you might hear this called the universal or the core curriculum. This is what is offered to every single student. And what we know about research is that it shows that 80% of our students minimally should be able to be successful with the research-based instructional techniques that we use in our classrooms each and every day. For some of those students who are unable to be successful or to meet the standards in this primary level of instruction, they may get what is known as reteaching or small group instruction right within the tier 1 classroom. Sometimes we call that differentiation. Sometimes we call that small group teaching. But basically, there is an opportunity to target specific deficits that we're seeing with a student. If that's not successful, the student may be referred to tier 2 services that could take place outside of the classroom. And again, if they're still not successful with that additional service, we might see roughly 3 to 5% of our students being referred to tier 3 instruction or intensive intervention instruction, which might be something like increased frequency. So it might be every single day they're receiving this. It could be in smaller groups, like less than 3, and sometimes even administered in a 1-to-1 setting. All of this is dependent upon the child and their progress or lack thereof. That might be the reason why they're put in these services. So a tier 1 primary level service, again, occurs within the classroom. It is used scientifically based instruction with periodic screening or benchmarks, like I had mentioned. And our benchmarks are typically IXL data. We use benchmark assessment system from Fontes and Pinnell, and we do add others depending on the child's grade level. Early on in their educational journey, we might look at letter naming fluency. We might look at sight words recognition or our high frequency words that students might know and be able to recognize with success and also with independence, even using them in their reading and writing. So all of those things may be something that the P2 teachers might look at. And then as your child gets older and enters middle school, you might see scholastic reading inventory data. Again, that is a benchmark assessment that is provided to every student. It is normed and it is used simply for the purpose of understanding where the student is in measurement against grade level standards. It gives us an academic and behavioral baseline and helps us to identify learners who are struggling and may need additional support. So once we identify a student as being at risk of not meeting grade level expectations, we're going to apply some supplemental instruction. This type of instruction should not exceed an 8-week period and should be monitored closely. And that progress should be collected in the form of data. So this is typically not more of the same, but it is a different research-based approach to teaching the same targeted skill so that a student may be successful in a different way. It might be a group of students that are pulled together during class time. It could look like increased frequency of conferencing with students. It could be providing differentiated levels of assignments. And it could also, like I said, be something that is done in a reteaching concept to small groups, while other students in the classroom might be working independently with the skills that they are able to use on their own. When students are not successful in the tier 1 setting, we might refer them to tier 2 or targeted small group interventions. So this is increasing in intensity because the student has shown that their level of performance and their rate of progress suggests that they need that intensive instruction. So at this time, we'll be looking at a small group. It's usually not more than 5 students, and it may be on a frequency of every other day for 30 minutes. And what we're really increasing the intensity in is group size, frequency, duration of the service, and also the training of the person providing that service. So this might be a specified intervention teacher who has a specialty in that particular area. It is again in a small group setting, and this is not to exceed a grading period. It's usually roughly 8 to 10 weeks, and all along the while, this practitioner is collecting data and progress monitoring to see whether the student is responding to the interventions that are being put in place for them. And if not, we need to make decisions as to whether we're switching the intervention or we're recommending this child be be targeted for additional intensive instruction. So some examples of the tier 2 instruction that we have here in Millbrook is our WIN. We also have AIS teachers at the elementary level. We have math lab, multisensory reading program, and we also have study skills. So each of these settings will target a different group of skills deficits for our students, and might look a little bit differently. So we'll speak about that in just a moment. Tier 3 or intensive intervention is typically less than 5 students and on a daily basis for usually about 40 to 60 minutes, depending on the age of the student. We typically would see this for 10 to 15 weeks. And something really important to mention is that this is essentially a triple dip of core instruction. So we have the core instruction, we have a tier 2 support that might be something like every other day. And now we're adding that everyday component to really try and target whatever skills deficit the student has so that they can be successful and start to return back towards the target of meeting grade level standards. And again, we're always looking to move that child towards independence. One of the things that's very interesting is oftentimes students might have multiple different skills that are at deficit, and we really need to make a decision as to what we're going to target first. Because again, intensive instruction and interventions cannot fix all the gaps at once. So we're going to look at the highest leverage skill that if we were to fix that would help support the student's success across the board. I use some examples from a behavioral intervention for a tier 3 service for students. Right there, we have behavior intervention plans or a check-in, check-out system. And a check-in, check-out system can be really done with any support provider in the building. Oftentimes it is the school psychologist, the school counselor, it could be the principal, but it really can be any trusted adult who can help that student prepare for their day. Many times we know that students might come in with stress or anxiety and really just need an opportunity to get themselves together, and that might help them be successful. It may also help them to integrate some of the tools that they're learning in their counseling sessions. So it's going to depend on the student what's appropriate at the tier 3 level. But again, all of this is within the general education setting, still at this point on tier 3. Again, just to review the MTSS process, at the beginning of the school year, the committee will come together with a variety of data points and determine which students might be eligible for tier 1 or tier 2 interventions. And you might notice that the AIS or MTSS process doesn't start until a period into the school year. And that's really because, especially at the elementary grades, we expect to see what we refer to as a summer slide, where students may actually show regression over the summer if they're not in a text-rich environment or focusing on their academic skills. We actually may see them regress as much as 3 months in terms of their cognitive achievement. But what we also know is once we reintroduce our research-based instructional practices, oftentimes we're able to see students bounce back just as quickly in the first couple of weeks of school. Additionally, we need to have some metrics that we are using. So we give our students a little bit of time to settle into the routines before we are using our benchmark assessments to see where they are and begin to make decisions about who might need extra support and services. So when the tier 1 process begins, again, in the classroom, monitoring that student's progress, collecting data, it might help us to identify those students who might need additional supports outside the classroom. And again, remember that as we increase the frequency and also decrease the group size, we are actually increasing the intensity of that instruction. And therefore, we might be moving up the tiered system. So basically, folks always ask, well, what happens next? And basically what happens next is that tier 1 interventions are recommended for that 8 to 10 week mark. And then if the student does not respond to tiers 1, then subsequently 2 and 3, the MTSS team will consider making a referral to the CSE. And at that point, they will need to make contact with the parent and make sure that the parent is fully informed and on board. Again, if your child is moving through the MTSS process, you will be informed by your child's building, but before they're making a referral to the CSE, they're going to want to unpack all of the MTSS data with you. And that is something that happens, again, as a general education service in our academic intervention services. It might be WIN, math labs, study skills, multisensory reading instruction. All of those things can happen in a general education setting. It's not to say that things like multisensory reading instruction might not happen within a special education setting, but typically speaking, that would be then if it's special education, it would be non-integrated. So there wouldn't likely be general education peers. It might be in a group of 5 called a resource room, which could be targeted. It could also be specially designed instruction. So it is something that you'll often see in special education services. But in terms of an academic intervention service for multisensory reading, that is a general education service. So what might that look like? It will be targeted instruction in an identified area as needed. So again, we are targeting the highest leverage skill that if the student makes gains on, will be able to support them achieving all of their other academic areas. So both general and special education students can receive this support, but it may look very differently. We're also going to continue to look at the student's response to this placement and use past and present data to set appropriate interventions and targets for this student. And then most importantly, I'll keep saying it, as we progress monitor, progress monitor, progress monitor. Data is our friend when we're moving through this. And for so many reasons, because we want to make sure that we are targeting the right skill. We want to make sure that the intervention is being implemented with fidelity and that we're seeing progress, and that the student is showing growth over time. If not, it may not be the right intervention, or we might be targeting the wrong problem. So in the case of multisensory reading program, it is a research-based reading and spelling approach for all ages. It is exactly what it says in so much as that it is multisensory. So we're going to want to engage multiple senses at the same time. So if you look at the bottom left-hand corner where we have a child who looks like they're playing with a sand tray, and they're drawing the letter E, they're actually using the tip of their finger, which has a magic line straight to the brain. And they really, I mean, this is really important to incorporate if your child is struggling learning their letters and sounds. You want to make sure that they're using their finger, that it's tactile, that they can feel it, that they're using their muscles, and also that at the same time, they're actually saying the name of the name of the letter and the sound that it makes. So this is extremely important because we want to engage as many senses as possible, because that has more neurons in the brain firing, and that this is how it is so successful in supporting students, even those students who might have a specific learning disability with struggles in the area of language or reading. So one of the things that I am really proud of here in Millbrook, and I actually am going to go back for just 1 second. One of the things I'm really proud of here in Millbrook is that all of our classroom teachers in the elementary school who teach reading have been trained in the Orton-Gillingham approach or an Orton-Gillingham based program. So you might hear some other brand name programs, and all of our classroom teachers have been trained in either Orton-Gillingham or something similar that is based on the same multisensory approach. So all of our students in core instruction or that universal instruction are being exposed to this multisensory approach to teaching language, which is it's a very, very rare thing to find in a school district. But what's more is that we also have practitioners that are even trained deeper in the practices of multisensory reading approaches. And they do targeted small group or one-to-one instruction. And this work might include things like word study, structure for automatic decoding and spelling, word recognition, the spelling of high frequency and irregular words. It helps us to learn vocabulary. They speak about Greek and Latin roots, and it really helps you to pack and understand the affixes, prefixes, suffixes, and understand what exactly that means when attached to a root. So it's a lot of really interesting word study that can help students, especially those who have language difficulties. And it's been really successful. There's a lot of research that supports it and even supports its use with students with dyslexia. Another general education service that we offer our students that might be an academic support might be something called study skills. And it's typically one period in a student's day that might help them with strategies for assignment completion, organization, time management, self-advocacy, or even test-taking strategies. Teachers might engage in pre-teaching or reteaching of concepts that they might see in their classroom throughout the day. And this might be helpful, especially if a student struggles with retaining and understanding vocabulary, and teaching it in context is helpful for them to then generalize it into their classroom setting. So placement in this is based upon the recommendation of a building MTSS committee. And what it might look like is helping students to prioritize assignments, organize their materials, review or reteach or pre-teach classroom information, as I had mentioned. Also, there might be some project and long-term assignment breakdown with support. Oftentimes we have students who, if you tell them to write a research paper, they don't even understand where to start. So this might be helpful for their study skills teacher to be able to create a checklist that maybe they're just starting with an introduction, right? They found a topic and they're going to start an introduction. And then the teacher might give them the next bit of information that they're working on. And breaking it down along the way might allow a student to be successful when really their only issue was not knowing where to start or not knowing the structure or format of something. They certainly have the ability to do the work. They just don't even know how to organize the work that they're doing. It might help them with study or organization or prepping for upcoming assessments. It could also be used to work on classroom assignments with the support of a teacher nearby, and it could also be something that helps students who might need a little extra time completing their classroom tests. So when we have exhausted all of our options within the general education setting, we have gone through the MTSS process, we have utilized academic intervention services, and the child is still not responding to the interventions that we put in place. There may be a consideration for a referral for evaluation to the Committee on Special Education. So what does that even mean? A comprehensive evaluation, a full and comprehensive evaluation is often what it's called, will include 5 basic components. There is a classroom observation, which is typically conducted by the school psychologist. There is a social history form in which the parent will provide the social history of the child. There is an educational evaluation, which typically looks at academic achievement. And then there is a psychological evaluation. And this is sort of similar if you can think of like an IQ test. So there's going to be some normed assessments that a child will complete. And when I say normed, it means that those results are compared to their peers of students their age. And then there's also a medical health records review. And the reason we conduct this complete, full, comprehensive evaluation is so that we're looking at multiple different aspects which impact a child's education. In the same regard, when I had mentioned all along the way throughout the MTSS process or the AAS process, we're collecting data. So we're able to really try and hone in on what's working for the student, what's not been working for the student, and it might help to illuminate sort of the areas of deficit or difficulty that the student continues to present with. So that being said, a lot of times I know that it can be very tempting to want to skip the MTSS process because we think that we'll get our child help sooner. And while that is true, it may actually not benefit totally because there still may be data that we would need to collect to truly understand what exactly we need to target first in order to help our student make the most progress and be successful. There are some situations where even upon an initial evaluation through CSE, we notice something that we may want to test right up front. Sometimes students who are struggling with reading or language may actually have a speech and language disability, and the only way to find that is to properly evaluate in that area as well. So sometimes we have a neuropsychological evaluation to make sure that the function of the brain is not impacting the child's ability to learn. We might look at assistive technology evaluations. We might do speech and language evaluation, occupational therapy evaluation. In rare cases, we as the school district might refer for what is known as a psychiatric evaluation. We might have a physical therapy evaluation or a hearing evaluation. And the reason we're doing this is to see if the child qualifies for services under IDEA, which is the law that governs special education, and qualifies for services on having one of the 13 listed disabilities here. So these are the disabilities that are recognized under IDEA as eligible for special education services. So about 3/4 of the way down on the list, you'll see other health impairment. And oftentimes students who might have ADHD or something like that, they may have another health impairment and they may not necessarily need an IEP. They may have ADHD and they may require an IEP. And really the way in which that's determined is whether or not there's an impact on the child's education. So we're going to look not just at if the child does have a disability, but how is that disability impacting their ability to be successful and learn, benefit from instruction is often the phraseology that you'll hear. Once a child is classified as a student with a disability under IDEA, basically we're going to be following the continuum of special education services, which is most detailed, spelled out on the left-hand side of the screen. So as you'll see, it goes from the general education program all the way up to a residential program. So on the right side of the screen, you'll see some arrows, and the arrow says, we only move this far up as necessary, and our goal is always to return the student back down the continuum as rapidly and feasibly as possible where the student can be successful. So that speaks to what I mentioned earlier, the student's least restrictive environment. So our goal is always to have students in the general education program with their general education peers for as much of the day as possible. So when a student is referred and classified as a student with a disability under IDEA, it could be true that they are maintained throughout the school day in the general education setting, and all they really need is some related services support. So maybe they need some support with speech or occupational therapy or physical therapy, but throughout the day, they go to all of the general education classes with no academic support. So that's towards the bottom of this pyramid, and that is the least restrictive environment. There are some other cases where a student might need either consultant or whether it's direct or indirect consultant services. And what that means is that there's a special education teacher who is assigned either to push in the general education classroom and provide support to the student, either one-on-one or a small group. They might do assistance with the students, IEP needs as outlined. It might help keep the student on task. It might take notes and also learn along with the students so that they can support them later in a resource room setting. The indirect consultant model is when the teachers meet one-on-one or as a team. So a consultant teacher might support a student in one content area, or it could be in multiple content areas, and the special education teacher might meet with the team of teachers and support them in modifying the student's assignments or making adjustments to the learning environment in order to support the student how they learn best. So it might be something where there's weekly check-ins or communication with parents. It could also be support during testing, all to make sure that this child's individual needs are being met. Again, a consultant teacher is pushing into a general education program. Moving further up the continuum is a resource room. So a resource room is designed to support students in achieving their individually written IEP goals. So this is a supplementary instruction, and the primarily occurs within the classroom. The primary instruction occurs within the classroom, and the supplementary instruction occurs in a 5-to-1 resource room ratio. So basically, we provide resource room support in the area of reading, let's say. So a student is supported in the general education classroom with reading, and then we do supplementary instruction to support that student's individualized goals, if that's appropriate, in the resource room setting. And the cap on a resource room is 5 students to 1 teacher, and that is a special education teacher. The only exception to that is that a reading specialist can teach a resource room for reading instruction specifically. Resource room has a requirement of having 180 minutes of resource room instruction on a weekly basis. When we're looking at the continuum of special education services, another support service model that you might see is ICT, or integrated co-teaching. And that is where there are 2 teachers. One is a special education certified teacher that we typically call a strategies expert, and one is a content area expert that has mastered the curriculum and is the curriculum expert for that content area. So it could be a social studies teacher and a special education teacher. And these 2 teachers engage in co-planning, co-instructing, and co-assessing for their students. And there's multiple different models of what instruction might look like in a co-teaching setting. In the best case scenario, when co-teachers have been working together for quite some time, you can't even tell which is which. That's the best case scenario, where the general education teacher or the content expert starts to learn and understand the strategies that best serve special education students or students with disabilities. And the strategy specialist becomes a master of the content area as well. Some of the models of co-teaching that you might often see are 1 teach, 1 assist, 1 teach, 1 observe, alternative teaching, parallel teaching, station teaching, or team teaching. And there's little pictorials on this slide that sort of show you what it might look like in the classroom, but I'll explain what each might sound like as well. So in a 1 teach, 1 assist, or 1 teach, 1 observe model, one person is going to take the lead with the instructional responsibility, while the other is going to assist or support students with work, behavior, or assignments. In an alternative teaching setting, students are divided into 2 groups. One teacher is teaching a group of students, while the other teacher is pre-teaching the other group. So this might be something where they're working on vocabulary to preset the unit, etc. Typically speaking, all students will benefit from small group instruction, that we know. And we really like to see the general education, special education teacher alternating roles so that equal status is maintained, right? We don't want students to know which teacher is which necessarily. We just want them to know both teachers are there, they're both responsible for the whole group, and they're both there to help. What we definitely know about this is that we don't always want to see the students with disabilities grouped together. We want them to be exposed to how other students with different learning strengths are able to reason through certain learning challenges. And again, it's really beneficial for our general education students to hear how students with disabilities use their strategies to be successful when things are difficult. So additionally, we have a parallel teaching model. This is when students are divided into 2 groups, and they're teaching the exact same thing in both groups, right? So this requires that there's significant planning to make sure that essentially the instruction is exactly the same and within the same amount of time in both groups. What we like about this is that it lowers the student to teacher ratio, allows more interaction with each student on the part of the teacher, and also may allow for students to interact with one another more easily. Also, it allows teachers to monitor individual students' progress and their understanding of the content more closely because they're working with just a smaller group for that period of time. This also allows for different learning styles to be utilized so that students can be successful. In station teaching, which is one of my favorites, the curriculum content is divided into two parts typically. One person teaches the first half, and then the other might teach the second half, and then the groups switch. Sometimes you might see station teaching with even a third station where students are working on something independent and using time to practice their skills. It does increase instructional intensity, and there's a lot of ability to individualize. The one thing that's difficult is that when students need to work independently, if there's not an adult to monitor them, some students may get off task, and there also may be challenges with pacing or noise level in this particular model. In the best case scenario, we have students teachers team teaching, and that is when there's truly this kind of dance that happens in front of the classroom where both teachers are equally responsible and equally engaged in all of the instructional activities or model the note-taking strategies that students might need to use in order to be successful. It really allows both teachers' expertise to come into the instructional model for students to be successful. The co-teaching model works the best if there's joint planning time, a full division of responsibilities. Both teachers take ownership in developing a student's IEP, implementing classroom management strategies, communicating with parents, holding those parent conferences, and also working on classroom discipline or classroom management. One of the things that is interesting to note is that the co-teaching is actually not a required program on the Continuum of Special Education Services. We're not required by law to offer it, but actually we do have many of our students serviced within the ICT model because it allows them plenty of time with their general education peers, and we feel as though it's a benefit to all students. There is a maximum ratio where you can only have 12 students with IEPs, regardless of the type of ICT class, that can be supported in any one class at a time. There are regulations that suggest, but do not enforce legally, that there should be no more than 50% of the ICT class populated with special education students or students with disabilities. However, the one thing to note is that there have been situations, Millbrook is very tiny, where there have been just over 50% because there may not have been enough general education students who needed to take the particular course to populate the general education side of it. And then, of course, we would never want to prevent a student with a disability from taking the course simply because their peers didn't need to take it. So it's not a best practice. We do everything we can to make sure that there's no more than 50%, but it does happen from time to time. And what might it look like? Oh, this slide is, special class. Okay, special class students are also placed. This is a non-integrated setting with only students with disabilities in it. There is a similarity of academic, social, emotional, behavioral, or physical management needs, and the students' present levels of performance or where they are in terms of their academic development should be similar. A special class, depending on the type of special class, is no more than a 15-to-1 ratio. And it might be students who are far below grade level to students who are on grade level, but require maximum support to maintain achievement of learning standards. It could be that a student might have a high level of management needs that they need to be supported with, possibly some behavior intervention plans, or it could be true that a student has average skills in the area of behavior as well. Special class is the most restrictive program that the school district offers. And we do actually have special class programming for students. Like it says, it's no more than 15-to-1. We actually have special class or self-contained programming for students that is offered in an 8-to-1 ratio based on the needs of our students. So as your child requires it, there would be an IEP or individualized education plan that is developed for them. And here is just the different aspects of an IEP and who is responsible for them. So as we create it, there's many different practitioners, as you can see, might be related service providers, a special education teacher, it could be a guidance counselor, a school psychologist, a general education teacher, all contributing to this individualized plan that will maximize the possibility of your student being successful. When you look at the different parts of the IEP, one of the most important areas and needs to be detailed in terms of the description of how the student is performing is when they talk about the performance and learning characteristics in the area of academic achievement and function. So oftentimes we'll refer to these as the PLEPs, or the present levels of performance for an individual student. So this is going to be the first place I look anytime I'm looking at a student's IEP, because I want to know where exactly is this student in terms of their academic abilities, struggles, etc. So it should include data, specific levels for achievement, and also strategies that have been successfully used to support the student. Some quality indicators of present levels of performance are instructionally relevant information, identifying how the student is progressing towards the learning standards. They should be descriptive and specific about the student. They should provide basis for the annual goals. So once we know where a student is, we know that with quality instruction, we can predict where we would like them to end by that year or that annual goal. And that creates a direction for the appropriate provision of services. They're written in such a way that they're not using a lot of educational jargon. We really want parents and other professionals to be able to understand exactly what we mean. They're based on the results of individual evaluations and should also reflect the concerns of the parents in terms of their perspective on educating their child. We also want to know what the impact of this child's disability is on his or her ability to participate and progress in age-appropriate activities. So there's going to be not just the present levels of performance, but also what we need to do in order to support that student so they can continue to progress. And another very important part of the IEP is going to be the management needs and the effective management needs. So our management needs section is the what, and that is very helpful. So it's like, what kind of stuff does this student need in order to be able to do this work? When we're creating this, we really want to bullet these, make them very easy to read and understand. We want to consider the student's present levels of performance, or those PLEPs I had mentioned before. It should be repeated right in there, the content, materials, and environment, how that's going to impact the student. We need to talk about how learning is going to be measured and how should instruction be provided. And then we want to make sure that we're talking also about the why and how. So the effective student management needs is the how of the student's disability is going to affect their progress or their participation within the educational setting. And then with all that information, we're going to write those measurable annual goals. So measurable means that we want them to be able to be measured, monitored, and tracked. And annual suggests that we are not measuring them until the end of the school year. So we should not be using any drop down of state standards, but we really want to be able to look at the state standards and understand, you know, what that might look like in the classroom. What would we be asking a student to do or demonstrate in order to show that they're able to meet that standard? We would identify strengths and challenges and identify how their needs are linked to the general education classroom. And then we would create and identify a special education service, adaptation, accommodation, or modification that they may need, right? So it might be with support, the student is able to do this. And again, our goal is always to be able to then move on to them being able to do it independently. So your goal is going to be two parts, what the student does and what the teacher does. So what the student is able to do or required to do, and then how the teacher is going to measure it. So here's an example, and it often reads like a sentence. So like I had mentioned, giving the support of an instructional aid or given a formula and knowing the variables, the student will use the processes of rewrite, substitute, and evaluate with accuracy. So that might be something that is written for the first portion of the annual goal. And then you want to look at how exactly will we measure this? So we're looking to target 100% success or 4 out of 5 trials, right? And then we want to be able to talk about 4 consecutive trials with teacher devised worksheets and in terms of how we are going to tangibly progress monitor this. So we're creating these worksheets, we're administering them to the student, we're collecting data, and then how often are we going to be assessing this? Bi-weekly in this case. So if you read it like a sentence, it basically means do this goal this often in terms of the schedule, keep track of the performance by using this method, don't check for the criteria percentage or trial period until the annual review. And the reason for that is that we're not actually expecting a student to be able to do this successfully until the end of the year because it is an annual goal. If a student meets it too quickly in the school year, that means that it probably wasn't a hard enough goal, right? A rigorous enough goal for them. And if they aren't able to meet it, then it might have been something that was too aggressive in terms of their development or ability. And another thing that we talk about often that is often confused with special education, but again, this is a general education service, is what's known as Section 504 of the Americans with Disabilities Act. And what Section 504 states is that any person with a real or suspected disability, whether it's physical, mental, or social emotional, that substantially limits one or more life functions, sometimes also called life activities, is entitled to reasonable accommodations under law. So oftentimes parents will say to me, I don't know, does my student need a 504? Do they need an IEP? And while they're very similar, they're also different in many ways. And one of the largest things is, as I pointed out to you previously, there is an official evaluation. It is full and comprehensive that is done for classification under IDEA. Under ADA, the things that we need to know and understand is that a student has a real or suspected disability. What does that mean? Well, they have all the symptoms of ADHD, but they don't have a diagnosis. Or the student presents as anxious in the classroom, but I don't have a physician who's diagnosed them with that. Well, that's okay. If we look at the real or suspected disability and say, does this limit one or more life functions? And again, substantially limit one or more life functions. They might be entitled to accommodations, reasonable accommodations. I have a list here on the screen of life activities, which are included but not limited to breathing, walking, talking, hearing, seeing, sleeping, caring for oneself, performing manual tasks, and or working. Additionally, major bodily functions or immune system functions, digestive function, bowel function, bladder function, neurological, brain or respiratory function, circulatory, endocrine, or reproductive functions. If any of those is substantially limited, and to be quite honest with you, that's a term that is used without explicit definition. I've often heard if they are functioning below, half of their peer group, they might be considered to have a substantially limited life activity or life function. They might be entitled to accommodations in order to provide them access or the ability to benefit from instruction or access to the school environment. It could be something where someone might need access to the nurse, access to the bathroom, to snacks or water, a copy of class notes, breaks throughout the day. Some students who might have a mobility issue might require additional time in the hallways when they're not crowded, additional time to take tests. I mean, this is certainly not an exhaustive list, but it could be anything from, classroom accommodations of a scribe. And that's an interesting one because one of the things that the ADA Section 504 says is that just because it is an intermittent or episodic disability does not necessarily bar a student from having these accommodations. So say little Johnny breaks his arm and is not able to write for his exam, it doesn't mean that he fails his exams and doesn't get to take them. We might have to provide a scribe or an electronic device or assistive technology device in order for him to participate with his peers. It could be something where a student has a significant allergy and we have to make sure that the products in the restrooms are nut-free or oil-free, depending on whatever their particular ailment is. So these things are something that do not necessarily require the same full and comprehensive evaluation, but students might have rights to and may very well need in order to participate in the general education setting or in the school environment. It could be access to an elevator. It could be access to large print exams. They may not need any academic support, but they might need some kind of support or modification to the environment in order for them to benefit the same way other students are able to. If you have any questions about any of this, feel free to please contact myself, Dr. Watkins. You can contact Alexandra Chanowski in the Office of People Personnel Services. We're all more than happy to answer any questions or concerns that you might have and point you in the right direction of where to begin if you're looking to support your student. And how do I know? So when you're looking to say, I just don't know, is it 504? Is it IDEA? Basically, what we know is that under the child find law, if we have a student who's suspected of having a disability, it's our job, and we take this responsibility very seriously, to evaluate and to be able to point you in the right direction. So even if a child is evaluated under CSE or IDEA and does not have an educational impact and is not necessarily in need of services from the Committee on Special Education, it could be true that it might be appropriate to service them with accommodations under 504. And we'd be happy to point you in either of those directions. And the last thing for our folks, if you have any questions, like I said, please feel free to reach out to myself, Dr. Watkins, or Alexandra Chanowski in the Office of People Personnel Services. And with that, I wish you all a great night.